The desperation of trying to access drug rehab.
I was hitting my head against a brick wall basically, with CAT teams, with doctors and whatever else, and I was just getting nowhere.
It took Jamie 2 years. He's now a resident of Jericho House, but to get a place here he needed to detox from street Valium. He said the only NHS help he was offered was a heroin substitute, methadone. His friends and family paid for him to get private treatment.
If family and friends hadn't stepped in,
I could have been dead.
Jamie was treated at Abbeycare Scotland. The private provider is emerging from the pandemic with new premises in Erskine, more places and a strengthened relationship with the charity Jericho House. Money remains the stumbling block if you want to enter here for treatment. Both providers are working to improve public funding and end the current postcode lottery of referrals.
We are now maintaining dialogue with local authorities and we're getting a trickle of referrals coming in from them now, and hopefully that will increase, and if we can all do the same we can turn the tide on this.
Jericho House doesn't have its own detox facilities. In recent years 2 people have died on its waiting list, unable to access this treatment. The Greenock charity describes its link with Abbeycare as a godsend.
In the past we were competing for minimal resources with each other, and that doesn't do the people that need our services any favours.
Since December, 7 Jericho residents have had their place funded by their local authorities. That's more in 10 months than in the last 18 years of the service. Providers believe the system, though, needs to be more straightforward.
The individual person who wants to come into treatment, they're having to jump through a lot of hoops. That's the thing I would be saying has to improve. That period of time can be life or death.
When STV News spoke to Lee Howell in Jericho in 2019, he was one of the first to benefit from an informal link between the two services.
If anyone had told me back then that I'd be doing the stuff that I'm doing today, I never would have believed them. It's night and day.
Lee now works in community justice. He says understanding the difference between detox and residential rehab is essential for long-term recovery.
It was the same with my family. When I was in that detox centre, had said to me, you know, you're off the drugs now, Lee, there's no excuse. We're not doing this again. That was the moment the penny dropped for me and I thought, I'm in trouble. You know, this stuff saved my life.
We had this year alone since January 733 deaths. That's what's happened in Scotland, that's just half a year. It has to be quicker. The money's there, the pot is there to get used, let's use it.
With a £100 million investment, the Scottish Government say it is addressing the pathways into residential rehab. Providers hope working together means for some that access is no longer blocked. Sharon Frew, STV News.